This video here is about the CT scan. Just wanted to give you like a real-time review of how it went, how I felt, and what you can expect when you go have a CT scan of your abdomen and your bladder area. Okay, so I just left from my CT scan, and I don't take you guys with me on the inside because there are people, you know, in the waiting room, and I want to respect everybody's privacy. And then I was going to show you guys the CT scan room, but it went really fast. When she came out and got me, I just got to eat a little sugar. Okay, I just had to suck on a little piece of candy. And just because, I don't know, I just felt a little shaky. So if you guys don't know, my name is Anika. Welcome to my channel, Well with Anika. And this is another part of my UTI journey. I have been on this UTI journey since June, which is about a month after my hysterectomy surgery. And I wanted to come in and talk with you guys just about every step of the process. So prior to me coming to the CT scan, my last video, I talked about having a cystoscopy where he took a scope and looked inside my bladder with the camera. If you're interested in that, that video is the video before this one. Okay, so I got the CT scan scheduled, and it happened pretty quickly. It was 7 days out, but they had to get authorization from my insurance prior to me coming to the CT scan, and so that's why they book it 7 days out from the time of the appointment or call to make the appointment. So they tell you, I wanted the earliest appointment because I have clients later on this afternoon. I wanted to make sure I felt good so that you know, if I needed to cancel clients, it would give me enough time to reschedule them. Anyway, as I looked at the instructions for the CT scan, I wondered, was I able to eat this morning? You know, what all was I able to do? And my instructions really just said nothing about whether I should eat or not, just to arrive 15 minutes early. So I decided not to eat prior to coming, which was a good thing because she said that you can vomit once they add the contrast dye to your IV. Now, there are different CT scans. One is with contrast dye and the other is without. My doctor ordered with because I guess, you know, it's like getting to the point very quickly. When I showed up at the doctor's office, I was running really right on time. My appointment was for 9:30. My instructions were to be here at 9:15. I got here right at 9:14. She took me right in. I had to fill out one sheet of paperwork. I do suggest that you do everything you can on My Chart. So here in the state of Ohio, we have something called My Chart, which is through the Epic, you know, medical record system. And so when you check in on My Chart, you're able to fill out a lot of that paperwork that you normally get when you go to the doctor's office. And so I was able to do that last night with my pre-check-in. But when I got here, I did have a one-page questionnaire that was strictly about the CT scan. Had I had a CT scan before? If so, for what? Had I ever had contrast dye? If so, how did it react? Just very specific questions about the CT scan and the contrast dye. Now, I was concerned about having contrast dye because back in 2019, my mom had a kidney injury from contrast dye. And as a result, ended up with in stage 3 kidney failure. My brother also died of complications of kidney failure, and you know, and it eventually damaged his heart, and he passed away at 49 in 2020. And so I was kind of worried about having contrast dye because I didn't want injuries to my kidneys. Even though my kidneys are okay, there have been something that my doctor has always watched. My creatinine level has teetered back and forth in between, you know, 1 point something and then down to 0.8 something. So, you know, it does good. And then there's times that my kidney numbers come back not so good, but never to the point that I was diagnosed a stage in failure or anything. So I was concerned about that, but I just woke up this morning and I said, I'm just going to trust God and we're going to get this done because I want to get to the bottom of what's going on with, you know, my bladder, my urinary tract, my kidneys. Why is there blood in my urine? So if you've been following along, the last time I spoke with the doctor, I had the cystoscopy and a urinalysis. The bacteria was gone, but I still had blood in my urine. He gave me the impression that having blood in your urine wasn't really a big deal. He said that he has had blood in his urine from time to time for different various reasons. It comes and goes. And he says maybe it's just a process of healing from whatever, infection or whatever that I've had endured over the last 4 months. So back to the CT scan. So the technician comes out to get me after I fill out my paperwork, calls my name, calls me back, and we walk into the room where the big imaging machine is. There's this long skinny table that's coming out from the imaging machine. And when I say skinny, it's a skinny table. I don't know if they have other machines for people who are not this narrow, but I felt very uncomfortable being on the table, and I don't consider myself that big of a woman. So, it wasn't comfortable. She asked me to take my jacket off. She did ask me if I had to use the bathroom, so I did use the bathroom prior to going in, because sometimes when I get the jitters, I have to pee. So, she asked me to lie down on the table, shoes on, everything's on. I had my pants on, and I wore jeans. I would suggest that you not wear jeans. I would suggest that you would wear some sort of elastic waist, soft waist pair of pants or skirt or something along those lines, because she asked me as I was laying down on the table with my shoes, shirt, bra, panties, and everything on, to unbutton my pants and pull them down to my thighs. Then she put a bolster up under my legs and put a sheet over me as I was pulling down my pants. Left my panties on. I did ask her if I needed to remove my estrogen patch, and she told me no, that it would be fine. So you don't have to do that if you wear an estrogen patch. And she proceeded to look for a vein so she could do an IV. She tried on my right arm, couldn't find a vein, which is really my good arm. But she ended up finding a vein on my left arm, which that worked out fine. It didn't hurt as bad as it did the right. I can say that I am a little dehydrated this morning. My mouth was dry, but I think it was because I was nervous. And I just didn't know what to expect. So make sure you drink a good amount of water. My appointment was, like I said, at 9:30. I should have started drinking water at 6, and I probably would have been well hydrated by the time it was time for my appointment. But I didn't, so I was dehydrated. She had a hard time finding a vein, and I can imagine that being good when it comes to flushing your kidneys out, flushing this dye out of your system. So I'm trying to get in a good amount of water now so I can flush it out, but you want to make sure you're hydrated before you come. So she found a line, and she explained to me about this series of images that the machine was going to take. And as I'm laying on this very narrow plank, my head is in like a pillow that is concave, kind of dips in. My legs are on a bolster. My jeans are pulled down to my thighs, and I go sliding into this donut hole. And the closer I get to it, my heart starts to pound. I'm starting to have a little bit of an anxiety attack. And she told me to put my hands over my head, and I did, and that made it worse. Oh my God. I almost called out for her to come back in to let me out of there, because I didn't think I was going to make it. I literally had to start praying to God, because it was this close to being in my face to where I was like, my face was going to go in there. So I can imagine, had it been my chest or my thyroid or my face or something in my neck or something, I probably would have had a anxiety attack, or I would have had to reschedule because I wouldn't have been able to do it. So she said there were a series of pictures that it was going to take without contrast dye. Then she was going to come in and put the dye in my arm, and then take another series of pictures. There was going to be another break, and then she would take the IV out, and then there would be another series of pictures. I was on the table for about 12 minutes total, and when you get the contrast dye in your arm, it feels like you have, And she told me this. She said, you're going to feel a warmth in your throat, and then you're going to feel a warmth in your genital area as if you've peed on yourself. I'm going to tell you what it feels like. If you're a menopausal woman, it feels like a hot flash. You know, the hot flash that radiates up in here, and it feels like it's coming up the back of your neck. It feels like a hot flash, or that hot flash that radiates down in your growing area, where you start to sweat in the creases of your growing area. It's a radiated heat that travels from your throat, almost an acid reflux feeling. Not necessarily a burn, but a very warm sensation, like acid reflux. And I imagine maybe that's my thyroid responding. I don't know, but it didn't feel like my throat was closing, just very warm, hot, flashy feeling. And I just started to get anxiety. My heart was racing. I can't wait to look at my Fitbit and see what my heart rate got up to. And then when it goes to your growing area, it didn't feel like I peed on myself. It was a warm sensation, but like I said, I can equate it more to a hot flash. I just started to get a little dizzy. And I know it was probably because I hadn't eaten anything and maybe my blood sugar was low. She also said that the contrast dye can make your heart race a little bit because it's a thicker solution than what your blood is. And it makes the heart pump a little harder. And to drink, again, tons of water to flush all of this out. Just to go through again, after the first couple of images without contrast dye, she comes in, starts the IV, the contrast dye goes in, there's a warm sensation, feels like a hot flash and acid reflux here, goes down your throat to your belly area, and then there's a very, very warm sensation in the genital area and around the top part of your thighs in your growing area. Once that happens, the machine does it automatically and will tell you to hold your breath. And then as you're holding your breath, these lights that are counting down until you can breathe again. And then the machine will tell you to breathe again. So that happened maybe about 5 times in total. Then she comes in, removes the IV, wraps my arm in tape with gauze. I will say one thing. She said to me that, because when I told her, she said, how are you doing, when she was taking my IV out? And I told her that I felt funny. And she said, funny how? Before I take this IV out, you have to explain to me what you mean. And I said, well, I feel a little lightheaded and my heart is racing and just kind of like anxious. And she says, okay, that's normal, and it just try to calm down. But she told me that if I had any itching, where I felt like my tongue was thick and couldn't breathe, where I felt hives was coming on, or, a type of allergic reaction or anything like that, that she needed to know some of those symptoms. And I said, no, I don't have any of those, just feeling a little anxious. And she said, just try to relax. We have about 3.5 more minutes. She says, just, get your heart rate down. And I took a couple of deep breaths and looked at my Fitbit. My heart rate, was down to 76. So I was starting to feel better. So yeah, if you are having some of the classic symptoms of an allergic reaction, like hives or itching, swelling of the tongue, or anything like that, where you feel like you're gonna pass out, then you need to let them know before she takes the IV out. Because at that point, she may be able to do something different, is what I'm assuming, to kind of help you or counteract the hives. All right. And there's about 7 minutes, and she starts cleaning up everything around me, disconnecting the IV and everything. And she says, well, we have about 3 more minutes, and it's going to pull you in the machine and take more pictures. And then it'll be over. And so, just like she said, it was a countdown, told me that it pulled me in, the light flashed, told me to hold my breath, and I want to say it was about 10 seconds, 10 to 12 seconds, then told me to resume breathing again, and then it was over. Then it pulls you all the way out of the machine and lowers you down to the ground. And that kind of made me dizzy as well, because I think between the anxiety of it all, not eating, being dehydrated, and I have enough water in my system, and then this machine kind of like moving in and out, it was not a pleasurable experience. However, it wasn't something that I couldn't deal with and get through. It was a short period of time. I'm not gonna say it was quick and sweet, but if you have a good prayer life, prayer will get you through it, is all I can say. So yeah, afterwards she asked me, was I okay to sit up? I told her I was. I sat up on the side. Well, no, before that she told me to pull my pants up while the sheet was still on me. Like I said, don't wear jeans like I did. Wear soft elastic waist pants so you can just pull them up and down. Jeans, I kind of had to shimmy in, suck in, zip up, snap together and everything. So you want to make sure you have on soft elastic waist pants. And I set up, and I again felt a little lightheaded and just a little weird. It's just hard to explain. Even now that I'm sitting here and I'm kind of eating a little pieces of like soft peppermint candies just to get my blood sugar up, because like I said, I haven't eaten since about 9 o'clock last night, so it's been 13 hours since I've eaten anything, and I haven't had a lot of water this morning, so just trying to get my blood sugar up. So just make sure you have something, you know, to drink and eat immediately after, but do not eat beforehand, because she says you will throw up once that dye gets in, and you do not want to throw up laying on your back. So I hope this helps, and I hope it doesn't scare you. It's just a very real, right after account of what it's like to get a CT scan with contrast dye. Okay, I'm gonna go find me some food. You all have a good day and be well.